Hi, this is Irvin Eisenberg coming to you from Resilience Occupational Therapy. And here at my clinic, I work with people in pain all the time. And there's a lot that can be done to help people with pain. I continue to take courses in pain neuroscience education. And what follows is a brief assignment, actually, that I'm submitting in one of my courses, a hypothetical scenario where I'm speaking to a patient about the goals they have and how to address their pain condition. Hi, Bob. I hear that you're in a lot of pain and that you've had this pain for a while. I'm also hearing that you're doing a lot of work over the weekend, working in your big yard, and you're barely able to get up and move in the morning. This is not a sustainable pattern. You're sitting all day long at your office work, and that's really important for you to break that up. So let's initially talk about that. I really think we can get you better, but we're going to have to pace this and grade this back. So if you can get up every half hour would be ideal, but even every hour, hour and a half, setting an alarm throughout your workday, getting up to use the bathroom or drink water or walk to somebody else's office for a meeting. See if you can really pace it out so that you're not sitting for more than an hour and a half at a time, or ideally not even a half hour at a time. I think that'd be really great for keeping your back from getting quite as stiff, and it's going to make your weekend activities easier. Now, it seems like you're working all day long in the yard and then really in pain. We're going to have to dial that back initially. I want to get you back up there, but we've already talked about the pain neuroscience and why your nervous system might be overly sensitive. Now we need to address that and teach your nervous system to be less sensitive to the pain. And the way we're going to do that is grading this. Get up in the morning, do what you need to get ready for the day, go out into the yard and do 1 hour of yard work. See how you feel. And if that feels good, stop regardless. Stop if it starts to feel too bad while you're doing it. But even if it's feeling great, I want you to stop. After that hour, and then take a break, take the rest of the day to do other things. And later on in the afternoon, when you're feeling ready again, do a little bit of stretching, prepare your body, and then go and do another 1 hour of yard work. See how that feels later in the day. See how that feels in the morning. If you're not feeling more pain than you normally do, and you're saying, hey, actually, I can get up in the morning, then this is good. Let's do it again on Sunday. So you did this on Saturday, do it on Sunday. You've got 1 hour in the morning, 1 hour in the afternoon. And if that's going well for you, we'll increase it later. Don't push through. Then you go back to your work week, try to get some good night's sleep. And we can certainly talk about sleep at some other point. And do your regular breaks. And what we're going to continue to do is increase that. We're either going to increase that by making it an hour and a half chunks. So you have 2 hour and a half chunks, or we're going to, depending on how the schedule works best for you, we'll do an hour and then another hour a few hours later, and then another hour. So there's a few different ways we can approach this, but we're going to continue to increase your capacity and increase your ability to do the work you need to do and hopefully have less pain along the way. I really think we can do this. I've helped people with back pain before. So that's a quick sample of what, it's a bit contrived, but the kind of conversation I might have with a client. Everyone's an individual. Everyone's got their own circumstance, and I'm always trying to meet their needs. This particular hypothetical scenario had this man who had back pain for 8 years and was having trouble being able to do yard work, and it's all pretty self-explanatory. And coming up with systematic goals, coming up with sleep strategies, which we'd address, teaching about the neuroscience of pain, which I'll do in other videos and do with clients all the time. All that has been proven to help people with chronic pain be more functional and decrease their pain.